why Indian healthcare is a bit expensive currently. It's not expensive as compared to other countries, but still it is rising and it's expensive because we do not innovate at all in India. Every product, especially in medtech, is either imported or through an MNC coming into India. So it's one of a kind effort. I think you won't find many examples of philanthropy being done through blockchain technology in the world. And India is, as you so know, the legal problems are always there, and this has been the most difficult bottleneck to, if I can say, the legal hurdles. We met many directors of many institutes who were wary of the term cryptocurrency and blockchain. We have met many political people also that sort of like just want to have the background check before talking to us. It's just funny. Even donating money can be a huge task. I never realized it in my life, but if you want to give out money, then also it's a big task, especially if you are giving out crypto money. There are 15 institutes in India which have received a 1 million grant from us, and we are going to add 15 more in coming days. There are 20 medical colleges associated with us that will be getting grant, including AIMS and other such big institutes. And there are many NGOs working in the health sector that have received grant from us. So total, if I may say, that we have a community of around more than 100 healthcare institutes, NGOs and medical colleges that are working towards research in India.
Thank you for joining the Ones Changing the World, India's first Future Tech Meets Sustainability podcast. I'm your host, Eddie Avil, and today I'm delighted and honored to have with me Dr. Gaurav Singh, who's a psychiatrist and a healthcare leader with 15 years of experience in mental health and community welfare. Dr. Singh established the Department of Psychiatry at KD Medical College. During COVID, he collaborated with over 50 major NGOs to allocate $60 million in relief across India. He's passionate about philanthropy and technology-driven impact. He's currently the CEO of Blockchain for Impact, founded by Sandeep Nelwal, the founder of Polygon Network. BFI was set up during the second wave of COVID pandemic in India and was created to help support those in need of help. As the world's most transparent healthcare fund, after the COVID wave, the focus transitioned towards strengthening India's healthcare ecosystem with their BFI Biome virtual network, a $15 million fund dedicated to advancing biomedical research and innovation in India. Thank you, Doctor, for taking time and being part of the podcast. It would be great if you could start with what urged you to transition from mental health to blockchain. And it would be great if you could also explain blockchain, what makes it unique, and why the Web3 industry, which was once touted as the most potential tech, has totally lost its charm and has been tainted by the NFT and crypto scams. And there have been entrepreneurs who have been just maximizing it for profits. Would be great if you could answer these three questions. Urged you transition from mental health to blockchain. What is blockchain? What makes it unique? And why has been blockchain tainted by entrepreneurs, and what can be done to reverse it?
I'm Dr. Gaurav Singh. I am CEO of Cryptorelief, also known as Blockchain for Impact. As you rightly pointed out, I am a mental health professional, spent 15 years in the mental health field. And I was also leading a medical college in North India, which was working during COVID times. And I was the medical administrator of that college. And during that time, as we all know, in 2021, during the Delta wave, there was a lot of suffering. There was a lot of disease that was going around and people needed help. So my founder, Sandeep Nelwal, raised out a call to the global crypto community to help him secure donations for India. And in that period of time, we secured a huge donation from around the globe and we started deploying that in India. We did a lot of work in India. Till date, we have contributed around 80 million to India, with a plan of 200 million more that we are going to contribute in coming years. So we started with oxygen concentrators, oxygen cylinders, makeshift hospitals. We also donated many equipments to various medical colleges and hospitals. We also did the largest genomic drive in India in which we sequenced COVID virus and helped out the scientific community. And after some period of time, it was evident that COVID is no longer an imminent threat. So we transitioned into the research part of it. That is how to prevent such future pandemics and to make a country more prepared for the same. Regarding blockchain, my blockchain knowledge started from 2021 itself since I joined this. And what I can see how blockchain held this whole effort is that my founder was able to put out a call on a, let's say, Twitter, and within 10 days he was able to gather support from all around the world and people started donating directly into its crypto wallet. This mode is not at all possible with any other charity. The only blockchain community and crypto has that power to actually accumulate such a number of wealth, plus deploying it also in the fastest period of time. And as you know that blockchain is basically an immutable ledger. So whatever you donate, whatever is given out from the wallet is available for everyone to see. So there cannot be any changes. Like we were currently discussing things like in India, there is a 31st March closing, and everyone is busy. If you can talk to any person, he will say that it's closing time. We are busy. So people will only be busy if they need to make changes in the ledger. But what if the ledger is immutable by itself? There cannot be any changes in that. So that is why blockchain has that power. The community has that power to make everything transparent and to make everything visible to the entire community just by virtue of login into a system.
Dr. Gaurav, I mean, kudos to you and your team to pulling this off. You mentioned that you gathered around $80 million for COVID, and the plan is to get another $200 million. And now you've transitioned to R&D, and you're trying to create a better innovation ecosystem here in India for the healthcare. So very, very interesting. And I think, yes, blockchain as a technology, I think no technology is ever good or bad, but I think the media always goes behind a technology. I think it's human nature that we've got this knack of taking everything good and corrupting it with capitalism, or maximizing things for profit. So I think it's humans who have twisted blockchain, which is such a beautifully unique text, which was originated obviously by Satoshi Nakamoto when he wrote his seminal Bitcoin white paper. And yes, the this new technology stack has got so many unique things, ethos in itself, from decentralization to immutability, fairness, transparency, and so on and so forth. Yes, I hope that, there are more projects in the world and more entrepreneurs who, instead of maximizing it for profit, leverage this technology and create larger impact for the betterment of everyone. I would also like to get your thoughts on India's regulatory and policy framework, because the Indian government's policy seems to be a little harsh when it comes to taxation, when it comes to these cryptocurrency, virtual digital assets or NFTs, with a 30% tax plus a 1% TDS. Get your thoughts on that, India's policy, as well as also maybe your thoughts on India's Web3 brain drain, because some of the smartest minds when it comes to blockchain or Web3 seems to have all transitioned or moved to for foreign shows. What considerations you think India needs to take to make a more empowering ecosystem when it comes to Web3?
Yes, so I will begin with the statement that the blockchain is inevitable. So everywhere you go and talk to the blockchain community, they understand that sooner or later it is going to be a part and parcel of everyone's life. But like for every new technology, even if you take example of electricity, people are wary of electricity also first coming into this world. It's like the same. So there are initial hiccups, and during these initial hiccups, people do tend to associate it with negative things. But in the long run, sooner or later, things will be clarified and people will adopt this technology slowly. The thing that you are saying about Indian government is, if I must say that we are late as compared to other countries in adopting this technology, that is for sure. Just because of the uncertainties in the regulations to start with, and now like since 2 years we have those regulations in place, but in starting there was a lot of uncertainty regarding how they must be classified, how they must be viewed by the public, whether it is legal or illegal. Still, if you talk to some people who are ignorant of blockchain, they consider it illegal, but it is totally not the fact. India is adopting Web3 technology. Blockchain projects are highly appreciated in India. That is not a problem. It's the cryptocurrency part that people are wary of, especially the finance department of India. So what we are seeing is a transition, and we hope that as an estimate, if I talk about numbers, it is predicted that 7% of Indian population is involved indirectly or directly with the cryptocurrency. So we hope that in coming times, things will ease out and blockchain will be more adopted, because like I said, it is inevitable. If you want to get rid of corruption, if you want to get more transparent, if you want to make things open source, blockchain is the answer for that. So it's like AI and blockchain that are currently the buzzwords, and they will continue to be the buzzwords in past 10 to 15 years till they are actually acceptable by each and every
right.
person.
That is that sure. We transition from being a buzzword to real world utility, because I think that's when the world will stand up and start noticing this. So since you have this blockchain for impact is largely for the healthcare industry, just wanted to also get your thoughts on India's healthcare industry, because the healthcare industry, at least here in India, the cost seems to be rising drastically. There's the cost is rising at like 14% annually. This is what I'm talking about, the healthcare. Now, even the healthcare as well as healthcare insurance seems to be largely about monetization, which I kind of pointed out earlier also. And then there was a report which I saw recently on Times of India and Z News. It's about this agency called Angels. It's a second opinion center which is based out of Navi Mumbai, Bombay. And their study claimed that 44% of all surgeries in Mumbai, which was advised by these reputed and talked doctors, from private and other hospitals, they were totally unnecessary surgeries. Because I mean, going back to my point earlier, I think greed has corrupted our society and our societal roots. Even like just talking about the health insurance space, I mean, I think the rest of the countries, I think the people of the country, when they age, they are celebrated. Yeah, what happens is like, I mean, when we work for the country for so many years, and after 60 years, I mean, when we actually become a senior citizen, when the government should be actually be taking care of the senior citizens, we kind of just leave them. The children obviously leave them. The government leaves them alone. What I'm trying to say, or what I'm pointing out here, is that the healthcare is so very expensive, and it's so divided. It's only the rich people who can get these, I mean, like quality healthcare. Do you see blockchain playing a role in standardizing healthcare, where you take away the inequities out of healthcare, and it enables like an healthcare for everyone, without the exploitation?
Yes, true. So you are very right in this regard. See, I'll first make few comments about this. India is entering an era in which the cheap medical facilities are now being replaced by the more systematized one, that is the corporate hospital sector. Plus, we are also entering into an era where there are a lot of legal cases that are there in the medical field and will also crop up in coming times when the system will grow. So, a doctor currently is very defensive. He does not want to take any risk. So, let it be if you say that some doctors do get some targets of a monthly target to cover their number of operations and all. It's very minute number. Most of the time, it's just because the doctor is afraid of the legal proceedings and the quality of care he wants to provide is of the utmost quality, that he opts for operations and all those things. And that's why the cost is also rising. Previously, the doctors were considered as God in our country. Now, it's more a consumer related affair if I look at the overall scenario. And there's also a lot of negative images that has been percolated in the media about the healthcare and the doctor itself, which has made doctor defensive over. Plus, like you said, there is a lot of corruption also. There are targets that you have to meet every year, which has actually led the cost to rise. But more point that I will point out, that why India healthcare is a bit expensive currently. It's not expensive compared to other countries, but still it is rising and it's expensive because we do not innovate at all in India. Every product, especially in medtech, is either imported or through an MNC coming into India. So the major problem that we have is we are not doing enough innovations. We may produce goods that are a high volume and low cost, but we are not into the MRIs and the CTs and the cancer machines and all those things. And that leads to considerable expense on the medical side, especially when the dollar is rising and the rupee is dipping, because we have to import everything out of it. So one of the major aim for BFI, not the blockchain itself, I can say the blockchain for impact that we are doing, is promoting innovation, and innovation in a transparent way. So let's say if I am funding IIT in our country, and I am giving them money to innovate things, to give their risk funding to innovate in the MacTech side, we are actually helping them out to create an ecosystem in which the health expenses will actually go down in future. If you talk about blockchain, yes, blockchain does help us in actually removing the insufficiencies of the system. It is because there is no centralized power to determine the rates. There is no centralized system in which you can manipulate the market. So blockchain, if adopted in the healthcare sector, which is actually a very long shot as of now, because the sector is not that what you can say appreciative of it, it can definitely reduce the inefficiencies and the cost itself. If you just talk about the generic drugs itself, you can see a lot of difference between a generic drug price and an ethical drug price that is present in the market. If the blockchain technology is used to determine the prices, to determine the distribution system itself, it can reduce a lot of insufficiencies in the prices and can stabilize the whole system.
Doctor, I really, really hope and I wish that, we take out these inefficiency from the systems. So I hope that, like blockchain kind of seeps into all the industry verticals, including the healthcare space. And I completely double you when you say that, India as a country, I mean, we are not innovating, when it comes to the healthcare space. And I really, really hope that this kind of changes because just like you pointed out, I think we are very largely dependent upon, foreign companies to import these products, which is needed for the healthcare space. So will be great if you can kind of like elaborate on blockchain for impact. It will be great if you can also talk about your 15 million BFI Biome Virtual Network Fund, and it will be great if you could kind of share specific examples of these initiative of yours, which has kind of led to maybe some products, services, and solutions in the healthcare space.
Definitely. So like I said, we started with the relief efforts. We were previously called Cryptorelief. We did a lot of relief work. In fact, if I can give you one number, then at the time when the vaccination drive was going on in India, there was no shortage of vaccines, but there was shortage of syringes. So we had the government of India to procure 160 million syringes in India. So by an estimate, every 7 to 8% has been benefited by blockchain for impact through the syringes itself. And then there were many other cases in which we donated around ration kits, we donated around medical equipments and all. So at one point of time, we thought that, see, COVID is no longer a threat. And what we need to focus is on innovation and collaboration. So what we found out is that during COVID, there were many institutions working towards COVID, but there was no synergy in between them. If you must have seen the news channels itself, sometimes there is that this ivermectin is useful, this remdesivir is useful. There was no consensus. Everyone was trying to push their own agenda at the same time. And the research also in the whole country was not synchronized. On a same product, many different institutes were working in different levels of expertise. So what we first envisioned is how to bring all the stakeholders of medical research together. So what we found out is in India, the research takes place in 4 places. One is the institutes. The institutes are like the IITs, the ISCs, the BITS Pilanis, and all those institutions that do quality research. Then there are medical colleges who have a lot of patient database and also a research ecosystem in them also. Then the third is the industry. If I can example like Biocon and MolBio, who actually produce products for the healthcare industry. So our vision was how to bring all 3 of them together under a single umbrella to fund them and also fund the new startups that are emerging in this medtech space. So with this vision, we launched this BFI Biome program. In this BFI Biome program, what we are doing is if we have a partner institute, let's say IIT, we are giving out 1 million worth of grant for research itself. The grant is given in an yearly fashion and the grant is given upfront. One of the major problems that our country was facing is that you may apply for a project that the funding comes much later. Sometimes even the whole idea of project is going down the drain because of the delay of the funding. So we started giving it upfront. Secondly, we did not ask for any IP or royalty in that product. So many of time researchers do sell out their products, do sell out their research to the MNC and other countries just because they cannot meet the royalty clause and the IP clauses. So what we did is to remove those royalty and IP clauses. And also we are insisting that to make the research open source. If you are going to make the research open source, it's more likely that you get fund from us. So like blockchain community is all based on the open source model. We are also trying to inculcate this factor into the open source thing in the research itself. And last is the transparency. Whatever money we are giving, whatever money we are donating, where it is gone, how it is gone and how it is spent, we keep a track of it and also inform the community from time to time about what is the progress in the project. So this is what BFI Biome is. Currently, we have committed 15 million. And then in the same space, we are looking to commit over 100 million.
Sounds very, very exciting, because this almost like a no string attached, like a funding. I mean, it seems to be because you're saying that, there's no IP which is being taken up front. The funding is being given up front. And best of all, I think, it's an open source model, which is, I think, the need of the day, because I think, when we create innovation, we've forgotten that we are no longer in 1950 or 1960. We are in 2025 and the world demands, we're living in a hyper connected world, and the world demands that what we do is spread across for everyone, not just for a certain bunch of people or just for the affording category. So more power to you in this effort. And I hope that this kind of kicks drive the innovation ecosystem needed in India's healthcare space. Now, you mentioned that you are giving, like it's a $15 million fund supported. You're already given 1 million to IISC. What are the highlights, tasks, solutions, or any of the interesting projects born out of these BFI initiative? Will be great if you can talk about that. And what safeguards are in place to ensure that, supposing if you create these lab breakthroughs, where like the genomic drive that you kind of initiated through these lab, there are these breakthroughs. How do you translate these from a lab to the healthcare?
If you visit our website, you can see the projects listed there. And our theme is translational research only. So some research is done just to get answer to a particular science question. What we focus upon is whatever you are doing, how can it be for public good or translate into a product that is kept in a shopkeeper's shelf or purchased by everybody. So this is actually the basis of our donation. That is, we fund translational research mostly. This is one, and like I said, I'll just correct you a bit that we are not giving out 1 million just to ISC. There are 15 institutes in India which have received a 1 million grant from us, and we are going to add 15 more in coming days. There are 20 medical colleges associated with us that will be getting grant, including AIMS and other such big institutes. And there are many NGOs working in health sector that have received grant from us. So total, if I may say, that we have a community of around more than 100 healthcare institutes, NGOs, and medical colleges that are working towards research in India. So, like you also said, that how do we safeguard it? We actually don't believe in safeguarding the research. We believe that the research should be open to everyone, and everyone should have that access so that they can build more products over it. It's like a hackathon. You organize something that actually puts out a solution in the market, and people build upon that solution. It's good for the person itself, the organization itself, because actually you get a base, you get connections, you get what you can say an ecosystem that will help you to earn more, produce more, and create more products. So that is what we actually hope, that everyone who is doing the research makes it open source, makes it available for each other. I'll give you one example. I was visiting IITs in last year for the funding and the finalization of the contracts and all. The problem is I can see many young kids, 20 to 25 years of age, having a startup and working on the same product. The same product is in different stages. So we all know that all of them are not going to succeed. Only one of them is going to succeed. But just that because they're not willing to make it open source, they're not willing to discuss their proposals, they're not willing to make it out in public about what they are doing. So it's an end game for most of them. Only one is going to rise, and that is also a big question whether that one will rise or not. So in India, we call a term is used that is called as graveyard of prototypes. So what happens is when someone wants to open a startup or do a research, he will get funding, seed funding. And after making a prototype, he's not able to take that prototype to the business scale, just because of these issues, that either he doesn't have expertise, he's wary of the IP clauses, he does not know how to interact with the community and the business world and to take more funding. So 99% of the startups that are in medtech sectors end up in failure. Either they close it or they sell it to an MNC and move forward. So this is the problem statement that we see, and we are looking to change, is that how can we fund them to actually move from the prototyping stage also to take it to the community itself. Plus, like I said, we insist them to discuss their research, discuss it in open, discuss with other IITs and ISCs and other places where such type of work is going on, and then take it forward. Like I said, if someone is going to take my research to a higher level, I think I should be happy instead of feeling a sense of competitiveness, because that is good for the country itself.
Doctor, what's the grant disbursement process? And is this only for institutes, medical colleges, which you mentioned, or is it also open for general startups also? And is there like a specific metric which determines like which biomedical challenges gets prioritized at BFI?
So we insist that the project that are submitted should be very much for the public good. One. The second, it should be a risk funding type project. if I will try to explain this funding, I can say that there are fundings in which there are low hanging fruits. You know that if you're going to invest some money in this thing, then you will get the reward. But what we insist to scientists is that go for high risk projects. High risk project means that the work is not being done in that particular field because the chances of failure are high. But if it goes through, then it's a disruptive technology for the whole country. So we insist that it should be a risk funding that produces a lot of results if it goes through. Second, it should be, like I said, for the public good and translational in nature. What we do is we put out requests for proposals openly on our website, and anyone can apply on that. The only thing that you should have is an FCRA license. That is, you should be able to get the foreign donations in India. And if you have that requirement, you can fulfill the requirements of the RFP itself and can apply for the project. Then it goes through a rigorous process of evaluation that is also very decentralized through various experts throughout the country. Just to give you a context, we put out an RFP for medical colleges called Samarth 1 month back, and we received 120 unique applications from throughout the country. So out of 500 odd medical colleges throughout the country, 120
Wow.
applied for the same
Interesting. I mean, we need more initiatives like this, to kind of, kick drive the ecosystem, because yes, the healthcare, there are so many bright students, bright researchers, but yes, I think maybe they are always waiting for that ecosystem support, which comes from the government as well as the funding ecosystem. I speak to a lot of these breakthrough entrepreneurs here in India, and there are startups who are building, in the medtech space, in the brain computer interface spaces and things like that. What's that one breakthrough that you're betting on that could put India on the map as a global healthcare leader?
Yeah, like you said, so medtech is very different from edtech and fintech. So in edtech and fintech are more about applications and computer interfaces and AI. Medtech is mostly about making a product that can be kept in your house, can be kept in a hospital. So what breakthrough I am looking, if I personally see, is can we build an indigenous MRI machine? Can we build an indigenous CT scan machine? We can do this. How I am sure about is that when COVID came, you can see a lot of indigenous ventilators that started coming into the market. The RT-PCR machines are also being coming to the market during the COVID times. So we have that capability. But when we reach out to those CT scan machines, the MRI machine, the cyclotrons, and the mass spectrometers, that is what I think is the breakthrough, when we start building those heavy machineries
Right.
that are required in
Right. Looking beyond healthcare, what underfunded or undeserved SDG sectors you think could benefit most from blockchains, technology, trust, architecture?
Yeah, so public distribution systems and fintech can be actually based on blockchain technology. That is very much evident from many examples what we see. Even when we were doing the BFI work initially, we were helping out governments in rolling out blockchain projects in which they can issue certificates of COVID vaccination on blockchain. So I think blockchain has usages everywhere. If you are a CEO of a company and you have a board of directors of 10 people, it's actually a blockchain because 10 people are sitting together taking a decision, and it's a small blockchain community itself. Now just extend it to hundreds and thousands of people, and then you have an actual blockchain ecosystem itself. So everything is running on blockchain, everything is working on blockchain, just that the scale in which we envision a Web3 space or a blockchain technology is huge. So I think there are many use cases, but public health system and public health delivery systems is the most immediate use case that I
You've been vested in philanthropy. What do you think, or what are your thoughts on the traditional philanthropy, and how do you think blockchain here could make a difference?
Yeah, so before coming into the sector of philanthropy, I had a very different view of what philanthropy looks like. But then I must be honest, I can say that what I realized in the initial part of my this work is that philanthropy is nothing but just a business that does not pay taxes. As simple as that. So there are salaries, there are expenses, there are people who want to join, who are people who are leaving. It's running like a company itself. It's just that the primary motive is philanthropy. So what I was worried about is when I came into this sector in the starting is the cost. So if you can say that I am donating $100 to someone, then you can see that 10% will be the institutional cost, 30% will be the HR cost, and only 40% is going to the purpose that I am donating the things. So this is what we are worried about, and blockchain can help a lot in this. Because what happens is, because of the transparency and everything being open source, you can exclude a lot of middlemen in the process. For example, if you donate something to BFI, then it goes directly into this crypto wallet. And from crypto wallet, you can seamlessly see that it goes to the philanthropic agency working in India. So we do not require any person, any banking system in between to intervene, and we have to pay banking charges and all those things. We have to pay accountancy charges and all those things. That is not necessary in the blockchain part itself. Now, the other problem that we face is the KYC part, but now there are many agencies that can also do the KYC thing for you in the blockchain industry. And sooner, what we think is we are a much more efficient organization just because our base is blockchain as compared to other organizations. I can also bet one more thing: if you go to a particular organization's website that is working in philanthropy for a long time, they can never let you know how much did they spend and how much did they receive. That clearly as compared to what we can do. If you visit our website, you can see what is the incoming, what is the outgoing, what is the blank balance, everything is there. This is possible just because of the blockchain technology itself. We did try to implement the blockchain technology in the local ecosystem of India also, but it will take time because honestly, they cannot have a separate accountancy just for us because they take donations from many other organizations also. But we hope in coming period, they also start adopting this blockchain technology and become more transparent. So we have this transparency level up to where they receive the fund. From beyond that, we also want to introduce the blockchain system so that person who is donating anything to us can track it to the last result itself.
I really hope that our future becomes a little bit more transparent, because I think so far humanities, all the businesses that we have built, whether it's businesses, whether it's institutions, it's governance, everything has a middleman. Even the big tech, everything has a middleman. And here is a technology which says that we are going to make things a little bit more equitable. Take the centralization that has been maybe creating the haziness or has forever had this middleman, take it out of the picture, which will make it beneficial for everyone. And that's what blockchain is, and that's what I think maybe every listener or every person needs to take away from this conversation is that technology per se is never good or bad, because we easily can paint maybe because of the volatility of cryptocurrency or, the haziness which was bought by entrepreneurs, just maximizing profit with, the scribble NFTs and so on and so forth. We had like a very terrible name for the technology blockchain. The blockchain as a technology is so beautiful because it says that it will take out the middleman out of the picture. It'll make things more transparent, more fair. And if we take that ethos, I think all our institutions, all our institutions will be so clear cut and so crystal, and everything will be fair. And there won't be these maybe 1,000 people in the world who's ruling the entire world, because we have these 1,000 possibly billionaires or trillionaires in the world who basically are running the entire world or who own the entire world, and we just act as puppets. So I hope that there is more block things, these tech stack like blockchain and AI kind of seeps into societal business sectors, institutions, and we see like more decentralization, and which will obviously make it more transparent and make the reach wider, rather than everything which seems to be narrower and which only serves the rich rather than the poor. When you take a technology which is as new as blockchain, though it's not like really new, but it's pretty new for our country, and it also has, because of like cryptocurrencies and NFTs, it's got like its own downside. What's been the largest bottleneck for you that you've encountered here in India, in your ecosystem, when you go out, make conversations with the government or the institutes? How do they react, and how do you convince these skeptics that blockchain can truly help what you're doing?
Yeah, it's a very good question because as you can see, previously we were called Cryptorelief and then we changed it to Blockchain for Impact. So you can definitely see the reason why we did so. Just because the crypto word was so demonized in India, and like if you're going with a good cause to an institute or a government setup that we want to talk and discuss, just by the name Cryptorelief, we were ostracized just even before getting into the system itself. So that was the major reason we had to change the name itself. But like I said, see, the only positive thing that we can show is the impact. If you're able to show the impact, if BFI is able to show the impact of the work done, then surely the whole scenario will change, the whole perception will change. So like currently people are associating crypto with scams and, like you said, NFTs and all. If we are able to produce some good products in market, if we are able to showcase some good research, then definitely the whole community will also think positive about us. So it's one of a kind effort. I think you won't find many examples of philanthropy being done through blockchain technology in the world. And India is, as you so know, the legal problems are always there, and this has been the most difficult bottleneck to, if I can say, the legal hurdles, because you cannot directly donate cryptocurrency in India. So what we do is we convert first into US dollars in our bank and then send it to India. So then it becomes a legal bottleneck just to discuss things about cryptocurrency, which is considered as illegal in India. We met many directors of many institutes who were wary of the term cryptocurrency and blockchain. We have met many political people also that sort of like just want to have the background check before talking to us. It's just funny. Even donating money can be a huge task. I never realized it in my life. But if you want to give out money, then also it's a big task, especially if you're giving out crypto money to anyone. So people are not ready to accept because they also think that it has those places from where it is coming may not be legitimate and all. But slowly and slowly, what we have created in India, especially in biomedical sector, is currently we are a name that most of the people know. So when we talk about funding from BFI, people readily accept it now. There is no resistance as such, but it took 3 years for to us to reach this position. But currently, at least no one talks about that the money is tainted or the money is crypto. Everyone is like, this organization is for research and it's doing a good job in the research field, and there is no harm in taking money from them. So like I will mention, we are also in talks with Government of India, the ANRF project, the Nusandhan National Research Foundation, the BIRAC project, which actually will be funding a startup through Indian government itself. So it's a lot of positivity. It's a lot of what you can say enthusiasm in the biomedical community, at least for BFI. Like I said, we put out a call for 10 fundings and we got 120 odd applications. And this is actually what shows that whatever we are doing is acceptable now. But we need more good examples. We need more use cases of blockchain technology. We need to make role models that are actually good in the crypto space, and then we are good to go for, let's say, in next 10 years.
I think we are definitely in need of good role models in the crypto space and the blockchain space. What's the roadmap? What comes next for blockchain for impact? And are there any updates that you would like to share? I mean, you said, there are so many applications that you are getting. I mean, what's been those interesting, applications or things that's come out from the BFI Biome virtual network funding?
So very interesting thing that we noticed is, since long we are talking about things that we should collaborate, we should do interdisciplinary research, but where is the incentive for the same? There's no incentive for interdisciplinary collaboration in our community. Why would an AIMS Delhi will talk to IIT Delhi when there is no benefit in that? Why can't they do it themselves? So this is what we are trying to bring in the ecosystem itself, to give incentive for collaboration itself. So my thing will be, if 3 to 4 different sectors are coming together for a project, I will be more likely to fund those projects as compared to if even only a single institute is aiming for funding. So like the blockchain ethos, we are looking for collaboration. We want people to talk to each other, to discuss things with each other, to share ideas. A doctor sharing idea with a scientist sitting in the lab will definitely result in something good for the community. And an NGO who's working on ground, the problem statement that he's trying to put forward is taken up by a person sitting in the lab and designing a product around that, is what we are looking forward is. So the major theme of our whole effort is collaboration and transparency.
And all the best for what you're aiming for. It looks, very for future forward in a country where everything is so siloed. It's not just the country. I think the world. We are forever completely siloed, and when we live in 2025, when we have these LLMs and these large language models, which is possibly maybe going to transition from just being statistical models to possibly becoming maybe generally aware machines, and I think the world needs to be more aware about this breakthrough of sorts, because there's a convergence of sorts at this point in time. As we speak, AI is converging with extended reality, it's converging with blockchain, and then we have these tech stack called as quantum computing, which possibly could happen in another 5 to 10 years or 20 years, but then when we have quantum computers, we will transition from possibly coding with binaries, which is zeros and ones to qubits, with possibly the atoms, and then maybe we might have a nano assembler through which maybe you could 3D print out anything, because you'll be possibly tinkering out with atoms, which we all made out. And if you have like a 3D nano assembler, which is like the dream of Eric Drexler, I mean, the world would be, obviously, besides that nano assembler, if you have artificial general intelligence, the world becomes very, 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 I mean, difficult to kind of comprehend, and I think in that world, we need to be more collaborative, open, rather than this inward, where everything is siloed and we just trying to hide what we're trying to do. I think the world demands that we are open and do things openly and share for everyone. What's that one piece of advice that you would want to share with students, startups, or researchers?
Like I said, the whole effort that I am doing, the result of whatever philanthropy we have done, is just based out of human compassion. In 2021, when there was a lot of death and disease in the country, our organization got donations from around the globe. It be US, Russia, UK, everywhere people donated. Even the celebrities donated, and those who could not donate big donated small. But everyone has that piece of compassion in themselves which wants to help out others. They just need a way. So blockchain is one of the ways in which you can reach out to the farthest corner of the world just to help out someone. So that is what I want to focus is that blockchain name is whatever demonized it is. We should be highlighting the good part of it. And for the young researchers and young students out there, BFI is there to help if you have a good idea. We are ready to invest in you. We are ready to take your ideas to places. It's just that you should be open enough to discuss your idea in public forum and make it possible. That is,
Right,
put
right.
your efforts into it. That should be
Right. Doctor,
message
you
from.
have been in the mental health space. You're a spiritual practitioner. Do you see blockchain fostering a paradigm shift in healthcare towards more holistic, more value-driven systems? Today, it's almost like a pandemic. There are these endemic, sort of where these young children are becoming depressed, and they need institutionalism, and so would be great if you could, talk about the mental health, spiritual practicing in today's day and age.
Right. So definition of spirituality varies from person to person. My definition is if you are ready to look beyond what you can see, you are spiritual. For me, a person who is sitting in a cave meditating and a scientist who is working in CERN trying to find out a new particle that can contribute to physics is spiritual in the same way, because both of them are looking to innovate or learn more about the surroundings and to just look beyond what is visible. So spirituality is personal subject and it should never be taken into consideration with things like religion and society. It's a matter of personal discussion, personal space. For, like you rightly said, there are many examples nowadays that people are getting depressed and people want to be millionaires. So what I say is there's no harm in thinking that you can become a millionaire. See, there can be no philanthropy without millionaires in this world. That is very true. They can, if there is no millionaires, everyone has the same equal amount of wealth, there cannot be any philanthropy at all. So just aim high, not a problem, but keep your basics right. Keep your ethos right, because if you are not virtuous, you are not keeping your ethos, your virtues right, sooner or later you will end up in trouble. So like the playbooks, every playbook is same. You can take Bible, you can take Quran, you can take Gita. Everyone has some written rules that do not do this, do not do that, just to make you a good person. And whatever rule book you want to follow, just remember, just helping the humanity, just being compassionate, and just thinking about the person next to you will keep you away from most of the problems, most of the time. Depression as such has become a buzzword, I think, because clinical depression is very different from the day-to-day depression that we talk about. It's just that if someone is ready to talk about it, there are many help available. We are also running a mental health helpline through BFI. Yeah, you can find it on our webpage and you can be directed towards that. But the basic thing about depression is you just try with your friends and families for some time, and if you're not able to get enough help, then you should actually seek a competent person in that regard. Let it be a counselor, a psychologist, or a psychiatrist. There's no harm in taking medications, there is no harm in taking counseling. It's just that you should realize that you are mentally unwell and take help.
Right. And it would be great if you could also, sort of my last question to you, paint a picture of what the world might look by 2035 with blockchain for impact doing its work, trying to create an ecosystem here in India. What are the goals and what are the visions that you're going after? So it would be great if you could paint a picture of what 2035 might look like, with BFI.
10 years from now, I see a pandemic coming to the world. It's a negative concept, that is, but let's say another COVID wave hits India after 10 years, and then each and every sector starts working to tackle that problem. Then the scientists sitting in the lab start the work on the virus. The NGOs on the ground also starts working to provide relief, to make people more aware. It's just that coordinated effort happens when the next wave comes. This is the vision of BFI. People should not be talking in silos. People should not be working in silos. Everyone should be working towards a common cause through, let's say, a common funding platform provided by BFI. And that platform is also adopted by Government of India to carry out the relief work, research work, and all the humanitarian aid that is required. So we just are focused on collaboration and the giving up of the silo thinking. This is what we look 10 years down the line. Also, we are thinking of a world in which blockchain technology is readily accepted. A person sitting anywhere in the world is able to donate for a cause and also see the effect of that donation to the last mile itself. We see a world in which there is lot less of the HR cost and the institutional cost in the philanthropy itself. We see a world in which if you are, let's say, a person who wants to donate, have that freedom to choose the project itself in which you want to donate. So these are the 3 to 4 things that we will like to work upon and see in the next 10 years.
Doctor, thank you for taking time and being part of the podcast. Wish you and the team at Blockchain for Impact the very best. And I hope that all that you spoke, all that you kind of visioned comes true. And yes, I mean, though you kind of, painted like maybe in 10 years, we might have a pandemic. We are definitely going towards that path, because we are tinkering around with biotechnology, with gene editing tools such as CRISPR-Cas9, where we are able to edit things out. And yes, I mean, technology itself is never good or bad. These technology tech stacks are becoming democratized and it's becoming more and more accessible. The humans, is us with or greed. I mean, yes, could possibly maybe tinker around and create a novel pandemic or a virus which could become a pandemic. And yes, I think India lagged behind, but I hope with now, I mean, with initiatives such as yourself, I think we are prepared for any kind of attacks, viruses through these initiatives. And I wish you the very best. And I hope what you said, I hope that blockchain as a technology gets its due because it's such a potential technology. It's got the power to make things more equitable, because we live in such a divided world. There is so many inequities, and blockchain as a technology is so profound, so powerful, and I think it can take those inequities away. But yes, I think we need brave entrepreneurs such as yourself who kind of push right the conversation and say that instead of going towards maximizing profit, we create a technology which is for everyone so that the goods of it is divided equally. So more power to you and to my listeners. If you like what you see in here, then please press the subscribe button. And until next time, so thank you, Doctor. Really appreciate this. Thank you.